Hello, I'm Steve Forbes, and this is What's Ahead, where 3 times a week we discuss issues that are important to you, the economy, and the nation's well-being. Today, I want to discuss what happened between Dr. Anthony Fauci and Senator Rand Paul in that Senate hearing on Tuesday. Dr. Fauci made clear he wanted a very slow reopening of schools, very slow reopening of the U.S. economy. Dr. Rand Paul, who is a medical doctor, took the opposite tack, saying we should take a more vigorous approach. Senator Paul is right. Concerning colleges and schools, the mortality rate for ages 0 to 18 have only been a handful of cases. Between ages 18 and 45, only 10 people out of 100,000 cases have succumbed to this dread disease. That's 10 out of 100,000. In short, leave school reopenings up to local districts. They can best judge what is right. And in terms of businesses, the same thing. Contrary to popular impression, patients who recover from this dread disease are immune to it. And thankfully, 97%, over 90% do recover from it. There is absolutely no evidence that people who get the disease are not immune to it. The models that predicted catastrophe have been proven wrong. In Britain, they've been off by a factor of 10. Those same models were applied to Sweden, where they did not close schools, they did not close businesses and restaurants. Those models predicted Sweden would suffer a death rate 15 times what has actually happened. Nationwide, one-size-fits-all approach no longer works. What happened in New York was special to New York because of the massive number of international travelers we had. That's why we suffered the horror far more than the rest of the country, with a few exceptions. Many local officials now are overreacting to this disease. In California, Elon Musk wondered why his plant was closed while pot shops were open. He defied the government and he won. A little more common sense would go a long ways. Critically important, the lockdowns now are doing in terms of health more harm than good. People with diseases such as diabetes, heart disease, and strokes are not getting the needed attention. Vaccines for children are not being given. Cancer diagnoses are down 30%. The lockdowns have also increased suicides, opioid abuse, domestic violence. It's now time to end these lockdowns carefully but forcefully. I'm Steve Forbes. Thank you for listening. Don't hesitate to send in comments and suggestions, and I look forward to talking with you soon again.